Friends, we have one more event for you on the stage, and it is really going to be extraordinary. And it's the perfect end because we've kind of come full circle with a question that was raised this morning, which is who is paying for our care? And we are very lucky to have with us this evening Assistant Secretary Lisa Gomez from the Department of Labor in conversation with Dan Gorenstein, who is the host and executive producer, I could have made that part up, of TradeOffs, which is an excellent podcast about healthcare policy. Without further ado, Lisa and Dan, please come on down. Here they come. Welcome.
Good afternoon, everybody. Hope you're doing well. We know we're the ones standing between you and drinks, so we'll try to be quick but informative. Lisa, thanks for being here. It's really exciting.
It's great to be here.
To be able to talk to you. You and I have had an opportunity to talk a little bit on some prep calls. And I think it'd be really nice to start this conversation with understanding you are very passionate about ensuring that people's mental health, their access to mental health and behavioral health services is protected and enhanced. Why is this so personal to you? Why does this matter to you?
Yeah, thanks, Dan. This matters just deeply to me because like so many people who have not been, who have lived with mental health and substance use disorders, whether themselves or in their families in this country. These are just not just words on a paper to me or stories that I'm reading about. I mean, I have lived with anxiety and depression pretty much my entire life, but I've seen how it can totally consume you, and also how you can live a very productive and wonderful life if you have access to treatment. I've been witness to mental health crises, substance use disorder crises with my own family, with friends, and witnessed and had to call, the hotlines to figure out what's happening and try to figure out how to get these people help. And I've witnessed people, friends and family who have either died by suicide, overdosed, been incarcerated, lost jobs, everything that can happen as a result. So to me, this is not just a regulation or a rule or just words on a paper. It's just so much more. And so I'm really passionate about it.
And so when you're down in Washington and you're working on regulations, you're talking to lawmakers, what have you, what are you thinking about? Who are you thinking about?
Well, I'm thinking about all of these people, and that there's just so many people out there who are not getting access to treatment, and how hard it is to just come to terms with the fact that, no matter how much we all say that there shouldn't be stigma and you should think about things in the same way, we're just not there yet. And so even for the person who is living with it themselves, it's much more difficult to say, there is something wrong here. I shouldn't be feeling this way, and I should go to a doctor to find out, to some kind of provider to find out what's going on and how I can address this. For some reason, that's so much more difficult than saying, my elbow feels funny, I should go to the doctor, or I've been having headaches, I should go to the doctor. It's just different, and it shouldn't be different, but it is. And so once people come to terms with that they do need help, there shouldn't be all of these barriers and hurdles for people to jump through after getting through what I think can be the hardest hurdle, which is just coming to terms with it yourself. So I also say that I don't know if it's the New York, New Jersey in me or the mom in me, but I don't give up easily. So, give me a challenge or tell me that you can't do something, and we'll have a little bit of a discussion about whether or not that's actually true, which is a little different than I'm finding. I'm the Washington outsider, so I'm finding that it's a little different than how some people think down there.
Bringing a little tenacity down to DC. Okay,
Yep.
all right. So, so you're alluding to parity, And but before we talk specifically about what parity is, and it's a policy conversation. We don't want to bore everybody, but this stuff actually really does matter, as you will know a lot more in about 19 minutes and 51 seconds. Clock is counting. I'd really like, it's weird, right? Because you are from the Department of Labor. I didn't know that the Department of Labor had anything to do with mental health. Can you just sort of like break down what your agency's purview is when it comes to this and why the DOL is even involved in the first place?
Sure, happy to. So I am the Assistant Secretary of the Employee Benefits Security Administration, or EBSA, which is an agency within the
Easy on
Department
those
of Labor.
acronyms. Careful.
Yes.
Careful.
EBSA, EBSA. And as I've said to some, as Tina Turner says, what's EBSA got to do with it?
I never heard her say that.
Yes, I'm like, yes. If she's not alive today, but if she was, I think she would say that. But yeah, what does the Department of Labor, or EBSA, have to do with any of this? Because I think most of the time people, if they need help, they'll think, I'll call HHS, I'll call the State Department of Insurance. But the reason why the Department of Labor, the Federal Department of Labor, is involved is because we regulate all of the private employment-sponsored healthcare plans in the country. So we're talking about plans covering about 133 million Americans. Pretty much anyone who has health coverage under age 65 has coverage under a plan that we regulate. We have 2.5 million health plans that we regulate. So if you or a patient or anyone you're working with has a health plan through their job and they're not working for a government, then we regulate that. So part of the Department of Labor, the main mission of the Department of Labor is to protect workers and their families. And so we are protecting workers and their families with respect to their benefits. So that's why we're involved in this situation, if Tina asks.
All right. So we're here to talk about parity. In layman's terms, what's parity?
So yeah, in layman's terms, when you get down to just brass tacks, parity just means that it shouldn't be harder, it shouldn't be more restrictive, and you shouldn't face more barriers in trying to get access to care or coverage for care for treatment of a mental health or substance use disorder than if you're looking for treatment for a medical or surgical condition. It just shouldn't be harder. You shouldn't have to, jump higher, run further, work harder to get those benefits. And the way that plays out in real world every day is it shouldn't take longer to get to a mental health provider than it does to get to a cardiologist. It shouldn't be that you have to submit more documentation to get a pre-authorization for therapy for depression than you need to if you need therapy for your knee that hurts. And it shouldn't be that reimbursement rates for providers of mental health are just not in line with reimbursement rates with providers who render the same types of services on the medical side. So all of these things, the barriers just should not be there. The restrictions, extra restrictions, should not be there. Things should be on par, with each other, whether you're talking about mental health, substance use, or substance use disorder, or medical surgical.
But we know in many cases, lots of people in this room know those barriers do exist. And so in as much as I'm really sort of fond of stories helping convey what this is all about, could you please provide us with a real world example of how a lack of parity plays out for people, where we see these problems actually exist? What does that look like?
Sure. So, at kind of different ends of the spectrum, we have a story of a young man, and these are, true stories. We have a story of a young man who was living with addiction and a substance use disorder and was seeking treatment and was contacting his health plan asking for a network provider that he could go to, because the plan did not cover providers that were out of the network. So they were giving him names, and everyone he called wasn't taking new patients, couldn't see him in 2 months. I mean, he couldn't tell his addiction to wait for 2 months until he could be seen. He was trying to get help. He finally went to a facility and said he was not leaving until someone saw him because he was in crisis. Rather than seeing him, they handed him a list of referrals for additional providers that he could call. He sadly did not do that. He went home and overdosed and died. So that's a sad story. A story that has more promise, though it's still a story of lack of parity, is a mom who had a teenage daughter who was suffering with acute mental illness and needed inpatient treatment. And the plan that she was covered under was giving her the runaround about pre-authorization, whether or not it would be covered. Her daughter needed treatment. The mother was paying out of her own pocket, took a second mortgage out on her home to pay for these costs, ran up bills of $200,000, over $200,000, and contacted our agency to tell us what her problems were, where she was running into issues. We were able to work with the health plan and get them to pay those claims and see how they were violating the law, and she got every cent of that back. So that's where parity. So that's where parity can work, and we can make it work.
And just a quick poll of the audience here. Make sure you all are sort of still with us. How many people have actually, either directly or indirectly, stories you know, have dealt with a lack of parity? Many, many people in this room. That person too. And so the Department of Labor is in the middle of this process of rewriting the regulations that have to do with parity. Can you give us a sense, again, a sort of 50,000-foot view? Like, what is it you're really trying to change in the regs to make sure that those two anecdotes that you just shared stop happening?
So in these, we issued proposed regulations working with the Department of Health and Human Services and the Department of Treasury. We issued proposed regulations at the end of last July on mental health parity and how the mental health parity law is supposed to work.
And real quick, sorry,
Yeah.
proposed regulations different
Yes.
than finalized regulations.
Exactly.
So this is still in process.
Exactly. So, but we are looking to finalize them this year. And the way, just give me 30 seconds, the way that the regulatory process works is we issue proposed regulations. The public is invited to provide comments. And so we got thousands and thousands of comments from all walks of life on these proposals, what worked, what didn't work, what we thought of, didn't think of. And so we take all of that into consideration and work on final regulations. So that's where we are right now, working on the final regulations. And what those regulations intend to do is to more clearly define what parity means and to look more closely at things like reimbursement rates for providers, network adequacy, pre-authorization requirements, all of these different barriers to access that are not really just numbers, like a limit on a number of visits or a dollar amount, but things that are kind of exclusions, things that are are a little bit more below the surface. And in these regulations, one thing that we're really trying to do is we have a lot of examples in there of actions that violate the law and actions that don't violate the law, so that people can see that these are things that if you're doing them are against the law, and that there are ways to comply with the law. If you do things in a certain way, you will comply with the law.
Sorry for interrupting you.
Sure.
What's the purpose? What are you trying to do there? What are you trying to signal? Why are you trying to give these examples, these real world examples for people?
Yeah, it's a great question. The reason why we're giving these examples, and the reason why I personally, why I personally thought it was very important to have examples where we showed people that you could comply with the law, is because what we kept hearing from the health plan community was we don't understand.
And
It's
sorry,
impossible.
when you say health plan, we're talking about
Yes.
health insurers.
Health
just to make
insurance,
sure
health
everybody's
plans,
with us.
right. We heard from them, this is too hard. We don't know what to do. It can't be done. And so, again, the Jersey, New York in me is like, I sat in a room with some people who said that, and I literally, I got up and said, you are a bunch of smart people. Don't tell me you can't fix this problem,
What did you really say? What did
Well, before I left the room or after I left the room? I said, after I walked out, I said, I can't believe I just did that. And people told me that was awesome. So the purpose is to try to show people, what you're doing that's wrong and what you can be doing that's right. And with the examples of what people are doing, what plans and insurance companies are doing that is correct, we also used real life examples. Plans that did see that there were problems, insurance companies that saw that their networks were not adequate and what they did to try to fix it. And so with all of these examples, we're kind of calling them on their
BS?
Yes. And, saying it can be done. So that's why I think it's really important.
And so when we did our backgrounder, Melissa asked us to kind of like focus on and try to engage the people in this room in terms of thinking about what can people do? And so I wanted to ask you, obviously a lack of parity is this major problem that requires help from the plans, the employers, everyday citizens. And in these background calls you and I had, you talked about, well, everybody needs to work together. Now that's one of those sort of platitudes that sounds nice or whatever, but what does that actually mean? And so I just want us to break this down sort of stakeholder group by stakeholder group with an eye towards the people in this room who in fact may fall into one of these categories and could in fact go do something. So when it comes to parity, let's start with patients. What could patients do?
Sure. So with patients, the system is broken. And I think we all as a group have to just admit that the system, the mental health system is broken. And we all need to be doing something to fix it. From a patient perspective, patients need to, number one, just not accept that it is what it is. And the system is broken. I'm never going to find people that are in the network. It just, that this is the way it is. If there are problems, or if you're not able to access care, contact us.
Contact who?
Contact the Department of Labor. You can contact the Department of Labor, our agency, EBSA, but just call the Department of Labor. Go to dol.gov. That's one thing. Write it down right now. dol.gov/EBSA. That's where we are.
Say that one more time, slow.
Yes. dol.gov/EBSA. So write that down. But if you contact the Department of Labor, HHS, the state insurance, if any patient calls and just says there's a problem, but I invite you to contact us, we will direct you to where you need to go. But we need to hear that there are problems and have people not just accept that it is the way it is from a patient perspective.
All right, and I know we want to save 5 minutes for questions, so we got to do sort of rapid fire time now. What about providers? What could providers do? There are probably some providers in this room.
Sure. So providers, I would say the same. Don't just accept that it is what it is. Contact us. Let us know what problems you're seeing. Report it so that we know what's going on and we can address it. We at EBSA. And if it's not us, we'll get you to the right place. But also providers need to be willing to take another look at this, and if not write off health insurance and health plans completely, if we are able to get on another path, on a better path through parity, to revisit joining networks and to try to work with insurance companies so that we can fix this system rather than giving up on it altogether.
Final group, stakeholder group, we'll talk about in these last 20 seconds, plans. What do you want the insurers to do different?
So one thing that just really gets me is that there's some obvious low-hanging fruit that we have identified and have put in reports to Congress. We talk about it all the time. Things like exclusions in plans that are just obviously illegal.
Illegal.
Illegal, that you cannot do. For example, if you have a plan that excludes coverage for nutritional counseling for eating disorders, but you cover nutritional counseling for someone who has cancer or diabetes, that is illegal. It's just stupid, but it's also illegal. If a plan excludes coverage for medication-assisted treatment for substance use disorder, that's probably illegal for them to do that. And it's probably based on stigma from 25 years ago about what people thought about medication-assisted treatment. If a plan is excluding coverage for ABA therapy for autism, treatment of autism, that is probably illegal. So there are certain things that are just very easy. And rather than waiting until the Department of Labor or some other regulator comes to their door to tell them they have to fix something, they should be fixing the easy things and focusing on the hard things.
And real quick, I know there's one more point, but we're tight. It's the expanding the networks.
Yeah, no, and other than that, they should be expanding, looking how to expand networks, thinking about looking at their numbers and seeing if they don't have enough mental health providers, why is that? You know, is it the rates? Is it, you know, bad experiences in the past? Is it, you know, the hoops that they make people jump through? What is the problem and what do they need to do to fix it? Because I would venture to guess that if they were running low on oncologists or cardiologists, they would be doing something about it. So they need to be doing the same thing with their mental health providers.
Great, thank you so much. Okay, we just got a couple minutes here. Please, sir.
Hi, I'm Carl Reddix, Jackson, Mississippi, with One Voice. The question is for mostly the insurers. One of the things that I think is missing in the mental health space is screenings, surveillance, like we do pap smears as a gynecologist or mammography. But the insurers don't pay for screening tests and wait for folks who have a substance use disorder to be in crisis and have a failed urine test before, and then they can say that, you know, or not do the test and say, I've got an issue and go get treatment. But it doesn't help, especially those folks in medicine or in law enforcement who are out facing the public and they're not screened. Mm-hmm. So I just like you to address doing mass surveillance for mental health and substance use disorders, especially for first responders.
Yeah, no, I mean, and I appreciate you bringing that up because that is another area where we've had a lot of complaints with people not having screenings, drug screening, urine tests, all of that covered by insurance companies when it comes to substance use disorders, mental health, but they do cover it, you know, in other cases. So things like that, no one should assume that the different regulatory bodies knows this is happening. You know, make sure you report it. And then we can either tell you, okay, I hear what you're saying, it's actually fine and this is why, or thank you for letting us know because there's lots of insurance companies that are doing that. We're going to add this one to the list and, you know, go enforce against them. So definitely, you know, make sure that you report when those things are happening.
Yeah, hi, Mark Pomper, a caregiver advocate. I just wanted to pick up on a point Dr. Sharon raised earlier, just that the system is often focused on process and not on outcomes. And I wonder to what extent the Department of Labor is shifting the incentive structures to create greater parity.
Yes, no, I did not plant him in the audience, but yes, we are focused very, you know, deeply on outcomes rather than just process. We don't want it to be.
What's an example of that?
So looking at not just, you know, do you have a list and did you check all the boxes that, you know, you check the guidelines, whether or not someone should be covered for this. I'm losing like an exact example right now, but you checked all the boxes. The person, you know, was not covered for, shouldn't not be covered for this condition. Rather than looking at what are the boxes that we have here that we're checking off, and do they result in a lack of parity? So are the outcomes that there is a lack of parity? Not just, when we apply the same rules to try to get mental health providers in the network that we apply to any other providers, but they're just not coming. It's like, what is the outcome, and how do we change the outcome? So we are very, very focused on that, because we know, at the end of the day, if we have a pretty chart that looks like, everybody's complying, isn't that wonderful? And yet that person still can't get treatment. What are we doing this for?
Thanks very much.
Mm-hmm.
Great. Maybe we'll indulge. One final question here.
I appreciate being indulged. So, Elisha Coffey from Mental Health America, and I'm looking at state level best practice examples. So, is there any state that are experiencing success holding health insurance providers accountable for reasonably reporting in ways that are understandable, and any states that are getting insurance companies to really comply with parity and enforcing parity?
Yeah, no, it's a good question. I apologize because I'm coming at it from the federal side and not, but there are definitely states that are looking at this and taking a harder look at parity. And we work closely with state partners and try to learn from them, and they from us. So I don't have an answer off the top of my head.
Is there any other entity that does also work with states that you might be able to direct her to?
Thank you.
Yeah, no, definitely. I would also go to HHS, Health and Human Services, because they, as the keepers of the marketplace, they deal more with the state insurance companies. So, but yeah, I mean, I think that there are some states like California is doing a good job. I know, but I don't know exact details. Sorry.
No, that's fine. Thank you, Lisa. I know I was throwing you a state level.
Yeah.
Thank you.
Okay. All right. And I just want to, I want to thank the crowd. I want to thank you, Lisa, for being here. And I just want to acknowledge, like, most federal officials do not talk like this. Thank you very much. Yes.